Okay, let's get started. So welcome everyone to the August VCI monthly webinar. I'm JP Pollock, the Chief Architect and one of the co-founders at Commons Project Foundation, standing in for Brian, our typical MC here. So we have a great agenda today. I'll get us kicked off with a little bit of happenings at VCI. Then we're going to hear from ARA, the American Immunization Registry Association. Then we're going to hear from the state of New York about updates there for what they've been doing with Excelsior Pass and smart health cards. Then we're going to hear from Delta Airlines from the verifier side. Great to get some of that perspective here in VCI meetings. Then we're going to hear about what Cerner is doing for their consumer portal to give people access to their smart health card QR codes. Then we're going to get a typical and brief technology update and status of things from Reese Adamson at MITRE. And then finally, I'll close us out and bring these things home. So these have been exciting times over the last couple of months since our last meeting. Exciting times for consumer access to health information, for health data interoperability, and of course for VCI. In the last couple of months since our last webinar, we've seen incredible progress with the smart health cards format. So CVS has joined Walmart in issuing smart health cards, and we're hoping for more of the retail pharmacies to be coming online very soon. Epic and Cerner have continued their rollout to support hundreds of health systems thus far. And the state of New York has upgraded their Excelsior Pass application to support smart health cards, which we'll hear about soon. We've also seen an increase in vaccine mandates across the country for indoor dining activities and other indoor activities from New York to New Orleans to San Francisco. For government employees at the federal level, at a number of states, for health systems across the country, and for dozens of major employers. Thanks to this, we've seen an increasing demand for people to get access to their smart health cards. Wanted to do a little bit of by the numbers, just where some of this stuff stands today. So VCI as an organization has been growing steadily. Currently, we have over 700 member organizations, which is a great testament to the importance of this for the healthcare ecosystem and beyond. The state of California just announced that they've issued 3 million smart health cards, which is a tremendous number in just the last couple of months, 8 weeks, I think. We were lucky enough to have the state present at our last webinar, and since then, the adoption has really taken off. It's quite impressive. The Smart Health Card Verifier application that we talked about at our last meeting has been downloaded over 23,000 times. So, I'm sure that some of those are folks on this call testing things out, but many of those are legitimate small businesses, schools, employers who are looking to verify health status of their employees using the Smart Health Card framework. And finally, after some analyses that we've been doing here based on the set of issuers that we currently have, availability to people who can gain access to these records through health systems that they see, through our large state representation of pharmacy chains, we've come to the conclusion that around 100 million people either do or within the next couple of weeks will have access to smart health cards. Certainly not have downloaded them yet. That will pick up as we see increases in demand across the country. But this is the number of Americans that we feel have access to smart health cards, which is really, truly incredible. So you all are not here to listen to my VCI propaganda. You're here to see our wonderful panelists talk about their various implementations and things going on. And first, I'd like to turn it over to Rebecca Coyle, the Executive Director of the American Immunization Registry Association, or ARA, as the first one's a mouthful. And look forward to hearing from you about what you are seeing in the landscape here, Rebecca.
Great, thank you so much for the introduction. And it's really a pleasure to be back in this group talking to you about some of the data that's behind the scenes. So what's going to feed into some of these smart health cards is really where we want to focus our conversation today. So I'm lucky enough to have Eric Larson, who's going to talk to us a little bit about sort of where the data is coming from and how that is flowing behind the scenes. Just by way of background, I know many of you may not have ever heard of an immunization registry or an immunization information system. They've been around for 30 years in a lot of locations. So these are not new systems. They are really public health systems that are utilized by every state health department as well as some of the local health departments, our US territories, and freely associated states. So there's broad adoption out there, and they're used for a variety of different purposes, including ordering and managing inventory for vaccines, working with schools and childcare populations, and then also managing some of the disease outbreaks. In fact, if you ever look at any COVID vaccination dashboard, you can be assured that that data is coming from IIS. So it's pretty widespread at this point. But I think what's important to really know about the data that's in these systems, or where this data is really coming from. So a bulk of the data is coming from electronic data exchange. So there are trusted exchanges that have been stood up over many years, over decades now, that really allow point-to-point data exchange. For our younger children, we often see a direct feed from vital records, so that very legal information is going directly from vital records into a state immunization registry. And then providers who are administering vaccines, whether that be the pediatrician, whether that be an emergency room or a urgent care, doesn't matter where a person accesses these immunizations, they have access to the immunization registry and can submit that information, as well as be able to look up and see what a person has had before. So really that comprehensive and usage of the full system capabilities. In 2019, and this was pre-COVID, we had over 117,000 data exchange connections across the US. So this trusted exchange framework has been in existence for quite some time and has really grown in the last few months. So what does the data look like within these systems? So we know nationally, and again, this is all pre-COVID, that we have about 96% of kids in the systems. If you look for the adults, you can see that we have about 60% of the population. Again, keep in mind, this is all pre-COVID. We're fairly confident that these numbers are going to change dramatically. We just won't have a chance to evaluate those till next year. So what does this mean for you if you're looking to try and access some of this information and want to make sure that somebody has information that could populate a smart health card? I think what this is really saying is that there is likely going to be a lot of information available. Where we sort of fit in this whole mix of what we do. So we are a member organization. Our members are state health departments and immunization information systems. And we also work very closely with CDC to help the states fulfill sort of that overarching mission of enhancing and maintaining these IIS over time. So we work very closely, we provide technical assistance. And I think from our perspective, we are really looking for something that's standards-based, that's easy to adopt. And there can't be a ton of different systems or different standards out there. We're really looking for solid concrete standards that every IIS can implement. Otherwise, there will be just sort of a hodgepodge of things out there. And the interoperability I think we've become so accustomed to will not be as robust as it has. I did just want to mention briefly just some policies that may access sort of how the Smart Health Card might be impacted. So for example, there are, every state has laws and policies that oversee the operation of these systems. So while they may contain a lot of information, who can actually access that is really determined at the jurisdictional level. So that might mean that a consumer may not have direct access to their information through the registry. They may need to go to their healthcare provider or to their pharmacy to actually get a copy of their complete immunization registry. There are also some jurisdictions that require explicit opt-in, meaning that if you don't sign a piece of paper to go into the system, that data may not be in there. So all of this can lead to whether or not all the information is really available. One thing I will note that is very different than any of our routine immunizations are that for the first time, we had a mandate for all providers administering COVID vaccines to report to an immunization registry. So what that means, particularly in today's setting, is that a lot of this data should be in there. The quality of the data, I think, is still what we're working through. We know that there are some, name changes, there's data entry errors, those types of things that jurisdictions are working fast and furiously to clean up. But it is comforting to know that the data should be in there. And then I just want to say, I think from the perspective of having IIS as an issuer, Eric's going to talk about who might be issuing these from our perspective. And IIS might be an issuer of these smart health cards. However, it is going to depend upon the resources available at the jurisdiction to be able to implement the technology And then one big component to this is sort of the verification or authentication of an individual. And often public health departments are not well equipped to do that. So it often defaults to providers that might be administering these vaccines. So with that, I'm going to turn it over to Eric, who's going to talk about some of the technical considerations and what does the issuer, or where does the data issuer, where does the issuer get the data? Sorry, Eric, it's all over to you.
Thanks, Rebecca. So, and you can go to the next slide, Rebecca. This is just kind of a nice high-level graphic of the IIS in the center of a bunch of data providers submitting data to the registry. And one thing to note on all of this is the relationship that an IIS has with so much of this is with facilities or clinics or pharmacies, mass vaccination sites, not often the individual themselves. And when we look at the classic VCI model, you'll notice that on the left-hand side is the issuer, kind of data sources issuers. We've seen it both ways. But what we see in practice often in those that have implemented it, and you've seen a few people share, is that the issuer and the data source might be separate. So an issuer might be a third-party software like a Docket or a MyIR, or maybe even Cerner, who's going to talk in a little bit. Maybe they get their data from the IIS using existing standards and then issue the verifiable credentials. So I think in theory, we've got those lumped together. In practice, we're starting to see more and more models where the IIS is being used as a data source, but not an issuer. And largely because of IIS are really, really good at immunization consolidation for a patient record. They haven't historically had to do the identity management that so many other systems already have in place. So I think looking at and thinking about how we could maybe decouple those in a lot of places is really what's happening in practice today. So I just wanted to touch on that real quickly and how that might be trending a little bit in what we're seeing in different places. Sometimes it's DMV, sometimes MyIR, which is an individual consumer app. Docket's another consumer app. Cerner is going to talk a little bit about their piece. So just some variation on how that's getting rolled out, which is, I think, fantastic to see. And Rebecca, I think for that, that's all I really wanted to touch on today.
Yeah, so just very quickly to sort of wrap up here, I think, from our organization perspective, I think we're very, very interested in this initiative. It seems like such a solid solution to meet not just today's needs, which I think is really important in immunizations. COVID vaccinations are really just another vaccine. I think, long before COVID and long after COVID, there will continue to be a need to provide proof of vaccination status. Anyone that has children that need to attend school or childcare or maybe go to camp have to do this usually on an annual basis. For some that travel, there may be a need to provide proof of yellow fever vaccination, or if you're traveling to Hajj, then proof of meningococcal vaccination might also be required. So there are use cases that exist outside of COVID. I think this is just really accelerating sort of the development of some of these purposes that I think we've always wanted and sort of modernizing this area. So from our side, we are working with our members to really help them understand sort of what's happening, what this is, that this is really just another standard that can be implemented by any IIS. And then we continue to offer education opportunities. And I noted a discovery session that we have on September 27th, which will really be talking about these. And anyone is welcome to join. It's on our website. And then I just want to say lastly, we've been really excited to work with VCI on this. They've been a big supporter of ERA. We're really happy to kind of see this happen so quickly. And thank you all for the opportunity. We will turn it back over.
Thank you so much, Rebecca and Eric. We've been incredibly excited to support and are very excited to continue working closely with ERA as we're looking for new ways to support all of the states throughout the process of making smart health cards available to people across the country. Now we'll switch and hear from the state of New York, the newest example of how states are able to make these data available to empower their constituents. So I'd like to introduce Sandra Beatty, the first Deputy Budget Director and COVID Task Force member for the state of New York. And I will be driving her slides. If she could just let me know how to advance, I will be happy to do that.
Thank you, JP. And I appreciate that prior presentation because so much about Excelsior Pass and the Excelsior Pass journey has really been about the underlying data and the data quality. And as we move to this combined effort to expand the definitions of verifiable sources and trusted issuers will continue to be an important topic as the collective effort moves forward. With that, by way of background, we have been on our first slide, the New York State mission relative to reopening our state economy. Since COVID had hit, we had thought about how would we reopen and what would individuals want. We launched the first Excelsior Pass, which is our first wave version, which was intended for verification purposes of, are you vaccinated, yes or no, a true false. That has evolved over time, one, as the marketplace has evolved, and also more importantly, as the consumers within our nation and internationally have evolved and become more acceptable and adaptable in this secure digital health credential conversation. We've newly launched an Excelsior Pass Plus, which is VCI Smart Card compliant. The photo you're seeing on this slide is our Excelsior Pass with minimal data that is available in that QR code. The QR code in this Excelsior Pass version really shows you what you're seeing there, your name, date of birth, the expiration date at the time really is 365 days from your 15 days post second dose on that pass. When you move to the next slide, you know, we really believed that the question here was public health or the economy, and that was always a false choice, right, in a lot of this national conversation. And it really is about, you need to choose both in order to drive a thoughtful process of science-based reopening. And this is really why we developed the Excelsior Pass in the beginning. With that, it offered an incentive to achieve a public health objective, which was safely reopening. And we launched it with recognizing that citizens were not ready at the time to have a digital health credential out there, and it really was a groundbreaking conversation. As we moved on, as we go into the next slide, you'll see that we have evolved, as has the technology and the community. So now what New Yorkers can get is they can have two different Excelsior passes. The first is the generic minimal information. We still have a group of individuals who this is what they feel more comfortable with. With that, with both of these passes that we're going to talk about, we have surpassed 3.75 million passes to date with the launch of both of these. On the Excelsior Pass Plus, this one also is a verifiable record of your complete vaccination card. So how it portrays is whatever is on your CDC card, the paper version, is what will be on the Excelsior Pass Plus card. All of these are available in the native Google and Apple wallets. They're also available in the New York State Excelsior wallet. The Excelsior wallet is the start of New York looking forward to how to centralize digital verifications across different instances that an individual resident within New York could need. Now, with all of this effort, we have always started from the foundation that everything needed to be free, secure, and voluntary. With that aspect, if you are a New York resident, all of these passes, whether you're trying to get your vaccination pass, your VCR pass, your antigen pass, they are free to the New Yorker and the New York resident. We also have, with the most recent releases, are that individuals who were New Yorkers but vaccinated in another state, we also now have reciprocal agreements and sharing of those records with those respective states. So for example, if you are a New York resident, but you were vaccinated in New Jersey, that individual now will be able to download the Excelsior Pass of their choosing. When I go on to the next slide, how it works, which is next, please. It really is this simple. This is just a little side-by-side of the difference between the two passes. We really felt that as we moved to provide more information in that QR code, which is in the Excelsior Pass Plus, that safety and privacy were at the top of what we had in mind for the standards that we were going to be looking for. That also is our process of looking through privacy and security standards naturally aligned with the efforts of many who are listening to this presentation and or on the panel. And that is how we arrived at the Smart Health Card VCI standards. With that, the Excelsior Pass Plus, New York State does have our own scanner, which scans both Excelsior Pass or Excelsior Pass Plus. The Excelsior Pass Plus card is scannable wherever smart health cards are accepted. Next slide, please. What does this mean and how does it work? The top of this is really just a simple graphic for an organization, and the bottom is if you're the individual. So for an organization defined as small business, medium, large, nonprofit, we're agnostic to the definition type. You can download the Excelsior Pass scanner app. And with that, you can go through the process of scanning in Excelsior Pass or Excelsior Plus Pass. For the individual, you go through the web portal on the New York State website and answer a series of questions, whether about your first name, last name, date of birth, your zip code. There's also challenge questions, all of the information that an individual would know based on their own records and also know based on their vaccination card. It was designed, no matter which one you're using, to be simple and straightforward for the individual citizen. And I think that is that aspect of equity and efficiency has been at the forefront of why there has never been within New York a mandate to use a digital credential. The CDC vaccination card with a photo identification would always be acceptable. On the equity side, we also have released in many different languages, nearly a dozen native languages for individuals who English may not be their first language. When I go on to the next slide, part of the equity and efficiency that we did was we put a lot of thought into what are the resources that are accompanying for the individual. So that includes a help desk, which is a toll-free number. That also includes extensive resources on the website. There's step-by-step instruction guides. You can also get marketing materials if you are a business looking to promote that you accept the use of Excelsior Pass. So we really looked at it from the individual and the business perspective in the resources that we provide. I would say that throughout this journey, one of the things that we continue to have, and that is if an individual has trouble receiving their pass. When you heard the prior presenters speak, individuals or facilities that were vaccinators of the COVID vaccine are required in every state to report into the immunization record. So with that being said, this requires a massive ecosystem of providers having clean data and having data that is correct and accurate when they're putting it into the immunization system. We have been at the forefront of ensuring that our immunization record system is the one version of the truth, and it is the verifiable version of the truth. When we go on to the next slide, the next one, please. I think this one I already went over for you. We are at 3.75 million as of this morning passes. And on the Excelsior Pass Plus, we are at 350,000 individuals, and we are only within the couple weeks of issuance. When we moved on, I also would like to say that all of this has been organic growth, meaning that the requirement to have an Excelsior Pass was always at individual option. So the nature of the organic growth and the way that we have seen the trajectory of passes being issued, even the rate of passes that are being issued for the Excelsior Pass Plus is on a trajectory to likely double on the passes if we continue based on the data that we have thus far. And let's remember that as of today, New York has over 23 million shots in arms, 52,000 over the last 24 hours. That obviously is a tremendous result of an effort of a lot of people within the state government and also out of state government to reach that monumental task of getting the shots in arms. I'd move on to the next slide and really talk about the three biggest things that are our lessons learned. I probably would add a fourth here, and the reason it's not on here is because of the spectrum of where we are at in our journey. But I cannot underscore the importance of having a good, clean data set, ensuring that the data has individuals' names spelled correctly, what the type of vaccination they received, the date, all of that stuff, which is so easy to just in a haste not enter correctly. Through our toll-free support hotline, we do a lot of troubleshooting for individuals, which does require calling back to the individual facility that vaccinated the person. If an individual within the state was not vaccinated at a state mass vaccination site and they were vaccinated by a private pharmacy or a city or county site, and if we do make those calls to those respective originators in order to help the individual get an Excelsior Pass, the bulk of the times when an individual cannot receive an Excelsior Pass, it is due to incorrect information entered by the facility who was doing the vaccination. Now that we're in this phase of Excelsior Pass Plus and in this national and international dialogue, the interoperability, which you will hear some from speakers that are to follow me, particularly on the scanner side. This interoperability is really important, not only for the efficiency and safety of individuals. If we have individuals using the VCI smart card standards, going through an airport or using it for travel, it's about ensuring the throughput and the individuals get through get through the process, get through the line. We don't want to have individuals from a public health perspective overcrowding because there is problems verifying their vaccination status. And then from the private sector side, you have that throughput issue of an airline needs to maximize getting individuals onboarded out the gate and safely to their destination. As part of all of this, when I talk about trusted issuers, this is something where I really think we need to have the federal government come to the table on the conversation of trusted issuers, and also how do you define a trusted issuer? How do you define and what is the definition of an authoritative source? We all have seen information out in the media relative to vaccination cards that may not be issued, and that may be fake cards. I guess I should just put it like that. So that is that on the trusted issuer, and I'm sure we will have many conversations relative to that. On the ecosystem thinking and our partnerships, I really do want to thank that in the very beginning of this, we had exhaustive conversations with many private sector partners and many states across New England, Mid-Atlantic, Great Lakes region, all with the hopes of trying to get a safe and secure reopening of each other's economy. We've entered into agreements with Marriott and Yankees and Broadway and Trust Ashore and US Air, American Airlines. So all of that was part of our conversations of how do we align around the same guiding principles, whether it is the industry guiding principle or it is the government's guiding principle. And the states have really had to, the state of California, you'll hear from later on in this conversation, they've also issued the VCI smart card compliant, and the states really have been driving this conversation about facilitating the ecosystem, in addition to the standards on the technology platforms that have been set by the broad coalitions that we are all convalescing around. Next slide, please. You know, now what's to come for us for next? I will say that we have various aspects that we are continuing to work on. One is we are constantly educating the consumer, particularly within the state, in addition to domestic and international partners. After we released Excelsior Pass Plus, we have seen an uptick in other countries contacting us to have a conversation relative to integration and how do we facilitate the smooth travel with travel partners. We also continue to work with and provide guidance to our states and local governments, sharing the lessons learned. And you know, look, there are some instances where the lessons learned may be more valuable than what the end result is. There's many policy questions that a government entity has to think through when entering into this digital health credential space. And, you know, we are, since we have just, put out the Excelsior Pass Plus. With that, we are continuing to have opportunities to drive broader adoption, particularly in this travel space. We also are looking to private industry as perhaps the shifting happens a little bit on the return to office with the increase in Delta variant in various areas. So all of that is an active conversations that we are engaged in on a daily basis. So on the future of Excelsior Pass Plus, meaning your vaccination cards and also your proof of testing, which I do not see testing going away anytime soon. That all is part of the important dialogue in how do you facilitate the interoperability as you move to these digital standards and maximize the public benefit at the same time. So with that, I'll just conclude and turn it over to JP, and then I will and answer any questions at a later time.
Thanks so much, Sandra. That was really great. It's great to hear about the journey that you've been on in getting from nothing to Excelsior Pass Plus. As a New Yorker, I've been able to experience firsthand New York's leadership in this area, and now the excitement of being able to get the credential that we've all been working on so hard for so long, and be able to use that beyond the borders of New York. It's really great. Next, we're going to shift gears and hear from Mahesh Gupta from Delta Airlines for some very welcome perspective from the verifier side of things. As we know, we spend a lot of time talking about issuance and specs and formats here at VCI, and don't hear quite enough from what's going on the verification side. And Delta has done some great work along these lines, and looking forward to what Mahesh has to share for us. Mahesh, if you want to take over the screen, you can go for it.
Thank you, JP. Can you hear me okay?
Good.
All right. So, and thank you, everyone. I think this slide has been very helpful for me to understand the verifier role. As you all can see that we have talked about the issuer, and the second and the third section is something that we all represent as an individual, because we need these passes in our wallet or in a form of paper, because they are going to make our life much easier. One thing that I have continuously seen, and our focus has been as we are in the recovery effort since the beginning of the COVID, is that how do we bring the journey as close to pre-COVID as possible, and then take the guesswork out and provide the self-help in an existing digital channel. So we have done some creative work that you will get to see in a moment, but I think all of that is happening because in the absence of a real technology solutions such as the Smart Health Card, which can make that entire process as close to pre-COVID as possible. May not be exactly same, but at least giving the peace of mind. And so I will jump into a quick use case, which is active right now in our production environment. We just recently launched a vaccine upload capability for a travel to Greece. And so I have just created one of the itinerary just to show you how does that use case look like, and then how the Smart Health Card can assist in that entire journey. So if some of you or all of you have traveled on Delta, then you basically are familiar with this screen where you pull up your PNR, and if your travel, it has capability to be able to interact electronically to provide your verification about the COVID, then you get to see this section separately here. Once you select the manage document, now because this itinerary is from Atlanta and going to Greece, so this one qualifies for multiple options depending upon that country rule. So you can see that it is you can even schedule a test or you can upload a test, but in addition to that, you can also upload a vaccine card. Now, this is where I was mentioning earlier that a vaccine card without a QR code is something that has been happening as an interim process or the beginning process, where most of the customers will show up in the airport, and then they will start showing these cards to our ACS or airport customer service agent. Now, we all understand that that is not their primary job for them. Their job is to take care of our customer in the navigation within the airport, check them in, or take care of them in the gate area. So this is an extra process which was coming way too close to the end of the journey. So we started offloading it and started giving a self-help as early in the process as possible. So we created this either upload your test or upload your vaccine record capability. And this is an integrated experience that you can experience today, where you just have to agree to some of the terms and conditions because you're sharing this information with us, basically through our partner. And then you can upload your information. I'm going to just pick up one of the health provider vaccination record because that's one of the examples, but you have choices of different type of card. Now, what is happening today, and we are going to be keep on evolving, and as we are getting the sophistication on the verification process where the APIs are available, we are going to be looking in the document if there is a QR code. So for example, let me just quickly show you the document that I'm about to upload. And that is going to be familiar because even this document is actually taken from a production version of the site. So this is a CVS health card, which is a smart health card QR code, but it has all the information available in this card too. And so in the absence of a QR code, we were reading this information and then comparing it with the country entry rule. But with the smart health card, the QR code, what it does, it takes that all the guesswork out, even from the system itself. And so there are two things that, as Sandra was talking about earlier, is that there is an issuer, and then of course the data itself, whether it is authenticated or not. So those are the two things that we have to validate. And so I'm learning more about the Common Trust Network, which means any of these cards, when they are being issued, they're issued from a proper authorities. And that is what is going to validate that A, the data that I am decoding is actually secure data and it has the right information. And B, the issuer that has issued this QR code is actually exists in the registry. And the reason I'm emphasizing on this one, because we have been talking to several governments of different countries where we are opening this travel. And many of them are at the fence that how can I trust the information that is being uploaded? But when we provide these two levels of trust, then it definitely makes them more comfortable because there is no guesswork out, there is no forgery that can happen with the physical card. So without further ado, I'm just going to quickly pick up that COVID vaccine card and just quickly show you that it is a simple process because I already have the context about this. And then in the process, there is a possibility if there is something that seems to be not working, then this process can be going in an offline mode. And I don't have to be on this screen if it is taking longer time. Because sometimes if the upload information is not something in the format that we were expecting, then it could be going into a human review process. So now I'm going to submit, and this is the process, because currently the Smart Health Card reader is not enabled on this screen, but you can see the entire process is going to be, if it was enabled on this particular one, which we are working on, then it should be a very instant process because reading a QR code is a very quick process, and then we should be able to get the results. But what I'm going to show you right now is that right now it is a manual process which is going through, and then eventually I will be able to get an information that I have a fly ready status and now I can fly. And I'm just going to show you the information that eventually will be presented in an email format. And just think about it is that getting that kind of an email prior to your travel, to your arrival, to your arrival airport, is that the peace of mind that you can get. And basically that is the process that we are working closely with the Common Trust Network and the Common Projects team, is that how do we incorporate some of those processes when we are scanning a QR code as a verifier, and then be able to provide that self-help in the hands of the customers. Now, in a situation where, so we are providing as much self-help as possible in the forefront. We are sending out a notification email that this is the process that you can avail, and then should be able to go ahead and upload the information. So once you receive this email, basically you have taken care of all the steps that you need to, other than some of the government specific related items, such as a PLF form or attestation form if you're traveling within the US. But in case of customers, those who did not do this, and when they end up showing up in the airport itself, in those circumstances, we will be looking at a situation where if this verifier process can also be incorporated in our our employee base, where an employee who has a mobile device already, and then if you have a wallet of your vaccine card in your wallet, then how can we able to just go ahead and screen it with the verifier app and be able to just again mark you, and there's no guesswork by the individual employee to read your information and to match it with what is that country's requirements are. So all in all, I think this overall process with the QR code enablement that we all have been eagerly waiting for, because in the absence of this, it has been a huge challenge for our customers as well as for our employees. One of the key challenges that we have heard is that what if you lose your paper card? It's a very stressful situation for our customer, but this digital wallet capability or a digital version of the card definitely gives our customer that peace of mind. That's all I have, and I will pass it back to JP. Thank you.
Great. Thanks so much, Mahesh. Great to see what you and Delta are doing in this space, and on top of things as always. With that, I'm going to turn things over to Nick Zweifel from Cerner. We've demoed in the past API access to Cerner's platform, helping individuals get access to their smart health cards through third-party applications. But now it's going to be great to see how they're making QR codes available to patients at various Cerner client institutions. Nick?
Thank you, JP. Excited to be here with this group. Really, it's really cool to see some of the additional efforts happening and be part of this conversation. What I wanted to do today is really talk about our Healthy Life Patient Portal. So I'm the product manager for that product at Cerner. And this is, the history of Healthy Life has been to serve as kind of that primary promoting interoperability or meaningful use access for patients to get to their health records. It's, patient portals have evolved to become very much part of the practice for healthcare providers today. As such, we wanted to make sure that this initiative was getting to consumers. And in June, on June 24th, we took the API work that we did and actually exposed a consumer-facing workflow so consumers could retrieve their own smart health cards for their COVID-19 vaccination records. It's been pretty fun for our team to take the guidance that this group has put together. A lot of you may be familiar with even the design asset on Figma. Our team was able to really start and finish this project within a matter of weeks because we had the API access that Michael's previously demonstrated. And we came in and our Healthy Life Patient Portal application just integrated this into our existing, what we have, a COVID center, a place where patients can come and see their latest laboratory results, if they have any reports or documents related to COVID, and their immunization records. And we just put a big button at the top. I didn't think too hard about it. I think that we're going to be looking for other tight integrations into our Healthy Life portal in the future, but wanted patients just to have a really clear access to this. We turned this feature on for over 1,200 portals in June. So that's a pretty big reach. And we've seen pretty good adoption for what we were expecting. Michael will talk a little bit more just here in a bit about the overall adoption. But patients can come to their Healthy Life portal. They'll click on that View Vaccine Verification, and this is the standard, the compliant health card. They are able to print this for offline access. We did really look hard at some of the other options that the standard provides, like downloading the smart health card file And I think those are things that we're going to look the best way to integrate in the future, including passing on to a smart health wallet. But we led with the physical representation of the QR code, presenting the information to the patient so they know what's involved. And then we learned pretty quickly that when consumers see a QR code, the first thing they want to do is scan it. And I think we're looking forward to other consumer platforms. The iOS 15 is going to be really helpful. So when consumers go to scan this themselves, there will be actually some functional use for them to get from that, to understand, oh, this is a digital record that I can now save in a smart in a health wallet. But this is really what we've offered to our consumers so far. It also has put us in a position to kind of learn the ecosystem out there of what verifiers are doing. Now that once we announced that we had this available, we started to get requests from patients saying, "Hey, I'm traveling to Dubai next month, and I need proof of my lab result or my vaccine, and can I get this from this QR code?" And it's not all QR codes are equal, and so we're also learning a lot about what is being asked of patients as they interact with other verifiers or other organizations that want to see some type of proof of immunization or a lab result. So this has been pretty exciting. They can print this from a mobile device or from the web browser. The same information is available here. The issuer organization, that there was some discussion earlier on the call that I thought was pretty interesting. What we show or what we make available for patients in terms of immunization records are what is documented in the EHR platform. Providers may have access to registries or other information through some type of health exchange, but what is available to patients in this workflow is any type of immunization record that has been reconciled back into the localized health provider's EHR. And so, it isn't as simple as if the consumer got their immunization from a local clinic, the health department, a local health department. It doesn't necessarily mean that they can log into their patient portal, Healthy Life, from primary care and get it. It's good. That answer is going to be very localized to the health system and interoperability practices. But this is available for patients who do have their records in their provider's EHR, and we're excited to see this take off more. I did want to. We looked at the numbers this morning. In the last 30 days, we've had over 45,000 views of the health record card itself, and then over 12,000 clicks to actually print the card. So that's been our implementation. We do have, in the future, we do plan to offer a health card for the lab results as well. We don't have a timeline yet for that, but that is something that we do plan to implement. And I think Michael wanted to say a few words and share the update from our API ecosystem.
Thanks, Nick. I appreciate the handoff. Wanted to make sure that my screen is visible to participants. Good to go. Okay, thank you. So yeah, just to wrap up here, with Cerner's engagement with VCI started almost 12 months ago now, and we've been, as Nick said, we've been really excited to be engaged in this and driving this forward, and being able to, in the US, really have some impact in terms of how we scale this to consumers. And so Nick touched on some of these numbers earlier. I just wanted to toot our own horn a little bit, I guess. Since the API was released, which occurred in June, over 90,000 health cards have been issued. Most of those through the Healthy Life portal, as Nick was demoing, but we have integrated with apps like Common Pass and others that will be coming online later this year, so that we can give consumers even more choices for how they access this information. But with the reach that Cerner has in our Healthy Life portal, this capability is now enabled for over 16 million consumers in the US. which is a big footprint that we're very proud of. And along with that, over 150 organizations using Cerner's EMR have been actively issuing health cards since we've released this capability just a few months ago. And we're glad to see that those organizations are recognized as trusted issuers by the trust frameworks that have been put in place around this standard. So that wraps it up for me and for Cerner. Thank you, JP, for giving us a venue and opportunity to share.
Thanks so much, Michael and Nick. This is really great progress to see. So exciting to see how many smart health cards are available to folks as we roll all of this out throughout your health systems. Reese, would you like to give a quick update on where things stand?
Sure.
Tech and whatnot perspective. Great.
Thanks, JP. And mostly I just wanted to highlight a couple testing and specification events that we have going on now. So folks who are working on their implementations and are interested in testing with others, we do have an HL7 Connect-a-thon track in September. So that's the 13th to 15th. You can still register for that. So if you have an implementation, you want to test with other issuers, other verifiers, and bring any of your technology or just dig more into the spec, we'd welcome people to come and join us there. It's a great event. And we'll have folks from VCI as well who are happy to answer questions and take a look at code if you have it. And the other thing we wanted to mention is that the Smart Health Cards Vaccination and Testing Implementation Guide is going through the HL7 ballot right now. So that's open from August 16th to September 15th. And so we welcome folks who are part of HL7 to take a look at that standard. And it's another important milestone for us to publish this standard through HL7. But with that, JP, I'll turn it over to you to close us out.
Thank you, as always, Reese. Great speed presenting. Much appreciated as we come close to time. And massive thank you to all of the presenters today. What we've seen here on this webinar has really been inspiring. To me, what we're seeing here is a confluence in timing of the increased availability of smart health cards, along with new restrictions that are falling into place across the country due to the Delta variant. And we really do seem to be reaching a tipping point, or perhaps we're already there. A couple of other things going on this morning. Samsung announced their support for smart health cards in Samsung Pay. So users of our Common Health app can export smart health cards from that app into Samsung Pay. And this has put us in a place where the three major smartphone producers and smartphone OS producers are all either now or in the very short term supporting smart health cards on their platforms, which should make it much easier for consumers to use their smart health cards and demonstrate vaccination status wherever they need to do so. We do have a lot of work to do here at VCI and some of the things that we'll be working on in the coming weeks. So you've heard about smart health cards beyond COVID vaccination records. So we are thinking deeply about use cases for this beyond COVID vaccine, including testing, of course, but also broader immunization records and beyond. And then things that you're likely to see will be some improvements to the VCI and smarthealth.cards websites. We're working on trying to make it more clear who's issuing smart health cards throughout the ecosystem, make it more clear who's accepting smart health cards. And then, of course, we're looking into what kind of tools and documentation we can produce that will make it easier for people to figure out how they'll be able to access their smart health cards. So with that quick closing, we'll sign off for August. I hope you all have a great rest of August and what's left of summer. Thanks so much.